This is the pelvic procedure, and again we start with a hit the lat. So underneath the thumb there on the outside corner of the patella, have a thumb up against it, skin slack towards the couch, and then we're doing this slow move, medial move upwards along there until it pops at the top. And if you don't get the pop, repeat the move in a slightly different place until you get that little pop when you go over the top of the muscle there. The second move is on the adductors. So for me, one of the schools I learned with said it was a gracilis, and the other one said it was the adductor longus, and that was a problem with Tom Bowen not explaining what he was doing. But for me, Tom would have done the most painful one, because that was the one causing a restriction. So when you go in there, you can tell from people's face whether you're on a really painful one or not, because it's so painful. You get hold of that muscle quite high up to the origin, and you want to squeeze, so you're squeezing with all your fingers for 20 seconds. You can see I'm using a towel just for privacy for the person, because you're being quite invasive, so it's best to explain to them how high up the leg you're doing, show it on yourself how high it is, and cover the area with a towel, which will make them feel more comfortable. And after 20 seconds, you wait for or it's best to ask for an out breath really, so take a nice breath in and then let it go, and then you do a move which is towards you. The third one is find the bone on the top of the leg there, get your thumbs together, and you're doing a medial move over the sartorius muscle there, which is attached to that bone. And again, on every one of these moves is on and out breath, which is something which I haven't explained much, but you wait for the person to do an out breath and then you do the move. The fourth part is lifting the knee. Get your hand underneath the knee and your other hand on the ankle, lift it up to that orientation. These two fingers then are doing a little move. It'll be a move looking like that on the inguinal ligament, okay? So it'll be a little move towards the opposite shoulder on the inguinal ligament at the same time as you're slowly moving the knee to that opposite shoulder, okay? So I'm getting underneath the inguinal ligament, which will feel like a little guitar string, lifting the leg up, asking the person to relax their muscles as much as possible to let me do the work, and then when you're moving, it's just a little move over that, a little move towards the opposite shoulder, and you can hold the opposite shoulder and push the knee up if you're strong enough. Some ladies need both hands on the knees to be able to push it up, but you just go into the natural limit of the person, and you can see from their face, if you're reading their face, you can see whether you've reached the limit. And then this is a variation. Most schools then will teach you to put the leg down and do the other side, but I like to actually do the variation of holding the leg at 90 degrees for 20 seconds or so, and ask the client to relax their muscles all the way down from the top of their neck, down their backs, all the way down. So relax your muscles all the way down, and do that for a count of 20 to 30. And sometimes when you're doing that relaxation, you can see the toes and the feet moving as the tension is releasing. And then we do a repeat of the extension to the opposite shoulder. Good. And then when you're letting the leg down, the technique is to actually straighten the leg. Hand under the knee, supporting the knee and supporting the ankle, and slowly let it down. Okay, and then we repeat on the other side. So move your towel to protecting this leg. The first move again is the hit the lat. So you got your, because we're now on this side, we're using our right hand, and underneath goes on the top corner. 2 thumbs together, skin slack down towards the couch, and then we're doing an upward move very slowly, maybe taking even up to 4, 5, 6 seconds till you bump over the top. The second move is a squeeze on either the gracilis or the adductors, whichever one is tight. We'll go to the gracilis this time, and you want to do a squeeze in there for 20 seconds with all of your fingers. See, I got my thumbs on the outside on top of the thigh, and my fingers are squeezing that muscle. And then after 20 seconds we ask the client to take a nice breath in, and then to let it go. And then on the out breath, on the end of the out breath, you do the move which is towards you. Next part is to find that bone on the front top of the leg there. 2 thumbs together. You're doing a move about 3 finger widths down below that bone, over the sartorius, and you're doing a medial move. Then we're lifting the knee up, putting our hand underneath there, underneath the kneecap. Your other hand, your fingers are split because you want to do a little bump over top of the inguinal ligament. So the inguinal ligament is in the crease of between where the leg joins the trunk. So skin slack down towards the couch. Take the weight of the leg. Ask your client to relax his muscles, and then move the knee and do that little tiny move over the ligament. You can put your other hand on the shoulder and move the knee towards the shoulder, or if you're not strong enough to do that, you could use both hands on the leg to push up. So remember, don't do this past 90 degrees if somebody's had a hip replacement. And be gentle if they're elderly doing it. And then when you come, this variation which I do is coming back to the leg to 90 degrees, you're holding, you're asking the client to relax down from his neck all the way down his back, right the way down to his sacrum. Relax all the muscles going down there. At the same time as that, I check the foot to see if there's any reactions, because if there's any tension leaving, there'll be a flutter in the feet. So we do that for about 20 seconds, and then we repeat the stretch to that opposite shoulder. And take your time doing that. And then after your stretch is finished, we get the leg straight, hold, protect the knee and the ankle, and slowly let the leg down. And then you can do you leave 2 to 5 minutes for the person then after that, because it could be a lot of tingling and muscles releasing now. And then after they've had their break, you could retest the height of the length of the legs. Just put your thumbs underneath the bone and see if your thumbs are level, because quite often if there's a change, if it looks like one leg is longer than the other, quite often it's just because the hips aren't balanced. There's a tension one side, or internal, a deep tension which needs to be released. Good.